Hey there, and welcome. Today we are talking all about a huge health trend you've probably seen everywhere, barefoot walking. And we're not just guessing here, we're diving into barefoot walking approved by family medicine specialists, based on some incredible insights from Dr. Lee Kyung-Sil. She's from the Life Clinic and was featured on the medical YouTube channel After the Rain. So let's get into the science of what's really going on.
Okay, so here's what we've got on tap. We're going to look at why this whole barefoot thing is booming, talk about healing from the ground up, and then get into the science of something called earthing. After that, we'll cover the risks, super important, give you a guide to walking safely, and wrap it all up with how this fits into your overall health. Let's do it.
All right, first section, the barefoot walking boom. So why is everyone suddenly ditching their shoes? Let's find out.
So you've probably seen them, right? People walking barefoot in parks, on hiking trails. It feels like they're everywhere these days. But what's the deal? Is this just another wellness fad that's going to disappear next year? Or is there something real, something tangible, that's making so many people kick off their shoes?
Well, check this out. According to the data that Dr. Lee shared on the After the Rain broadcast, the numbers pretty much speak for themselves. A whopping 60 to 70% of people who try barefoot walking report positive effects. Actual healing benefits. Then you've got a group who are kind of neutral, and only about 10% have anything negative to say. I mean, with numbers like that, it's no wonder this thing is catching on like wildfire.
Okay, so let's get into the nitty-gritty. What's actually happening to your body? This is Section 2, Healing from the Ground Up. We're talking about the physical science of your feet. This is where it gets really interesting. Think about your foot in a shoe. It's kind of like it's in a cast, right? The arch can get lazy and even start to collapse. The muscles are just passive. But when you take that shoe off, bam, your foot has to work the way nature intended. The arch is supported naturally, pressure gets spread out evenly, and all those little muscles wake up. Doctors actually call this activating the foot core system.
And this isn't just theory. Dr. Lee talked about some incredible research, including actual MRI scans. They looked at the foot of someone who had been walking barefoot for 10 years, and wow, the difference in muscle mass was huge, especially around the little toes, where our feet are usually pretty weak. This builds an incredibly strong, stable foundation for your entire body. It's literally the difference between building a house on solid rock versus shifting sand.
Okay, moving on. Beyond just the muscles, there's this other idea you might have heard about called earthing or grounding. Let's get into the science of connecting your body to the earth.
So what exactly is earthing? It's really simple at its core. It's the practice of putting your body in direct contact with the ground. Walking barefoot, maybe lying in the grass, or even swimming in a lake. The theory is that this connection allows for a transfer of energy from the earth to your body. And that can have some real healing benefits. And scientists are actually looking into this. Some of the early research has pointed to some pretty exciting potential benefits. We're talking about things like less stress, better sleep, reduced inflammation and chronic pain, even better blood flow and faster muscle recovery. It's a pretty impressive list. Yeah, over the past decade or so, we've seen a few of these studies pop up. For instance, one from 2013 suggested it could improve red blood cell flow, which hints at good things for your heart. And another one in 2018 looked at massage therapists, a super stressful job, and found that grounding helped reduce both their physical and emotional stress. Pretty cool, right? But, and this is a really big but, Dr. Lee brings us back to reality with a dose of professional medical perspective. She makes a super important point. There's a big difference between scientific evidence and medical evidence. She says that while these studies are interesting, they're mostly small, they are not the huge, large-scale clinical trials that doctors need to see before they can call something a proven medical fact. So, it's promising, but not quite there yet in the medical world.
Which brings us to our next crucial section, walking with caution. Because look, barefoot walking isn't for everyone, and it's so important that we talk about the risks.
Okay, listen up, because this part is non-negotiable. Dr. Lee is extremely clear about who needs to be cautious. If you have diabetes that isn't well controlled, especially if you have nerve damage, a tiny cut could turn into a huge problem. Same thing if you already have any wounds or sores on your feet. And if your foot muscles are really undeveloped, you could get injured. Oh, and one more thing. Make sure you're up to date on your tetanus shot. That's recommended every 10 years.
And let's bust a myth right now. You might have heard of this idea of a healing crisis. Some people call it Myeongyeon Hyensang. The idea that you have to push through pain to get better. Dr. Lee says absolutely not. If you feel pain, tingling, or just extreme fatigue, that is not a healing crisis. It is a sign you are overdoing it. It's your body's way of saying, hey, stop. So please, listen to your body.
Okay, now that we've got a balanced view, let's get to the good stuff. Here's your guide to safe walking. How do you actually start the right way?
So before you even go outside, you need to strengthen your feet. Dr. Lee suggests a few simple exercises you can do anywhere. First, try to lift the arch of your foot while keeping your toes flat on the ground. Then, try lifting just your big toe up and down. After that, try the opposite. Keep the big toe down and lift the other 4. And finally, see if you can spread all your toes apart, like you're opening a little fan. Doing these every day is key to preventing injuries.
All right, on to our final section, the path to true health. This is where we see how barefoot walking is really just one piece of a much bigger puzzle.
Dr. Lee has this really beautiful way of looking at health. She talks about 4 pillars. You got the obvious one, physical health, exercise, diet, sleep. But then there's mental health, having goals, staying curious, and emotional health, being resilient and self-aware. And finally, spiritual health, that sense of connection, whether it's to nature or other people. And what's so cool is that barefoot walking can actually support all 4 of these pillars.
So, here's the big question for you. Are you ready to reconnect? Not just with the ground beneath your feet, but with your own body. That's really what this is all about. It can be an incredibly powerful way to heal and become more self-aware, but only if you approach it with knowledge and respect for what your body is telling you.
So if you're thinking about trying this, our advice is to start your journey slowly. Seriously, just a few minutes is fine. Find a safe surface like soft soil or sand and just listen. Always listen to what your body is telling you. This is your journey, no one else's.
And hey, you're not alone in this. If you want to connect with other people, you should definitely join the Barefoot Walking National Movement headquarters on Naver Cafe. It's an amazing community where you can share information and learn from tons of other people who are on the same path.
And finally, if this explainer was helpful for you, it would mean the world to us if you'd support the channel. You know the drill. Subscribe, like this video, and turn on those notifications. It really does help us create more content just like this. Thanks so much for tuning in.